discussion. The author makes the points shown in the red line. In general, developmental care has small beneficial effects on the infant's short-term developmental outcome, but evidence is lacking that the effects persist after the age of 4 months corrected age. The therapeutic exercise is included in this developmental care. Similarly, this systematic review published in 2020 showed that early physiotherapy intervention by the therapist for high-risk infants contributes somewhat to motor development at the time of discharge from the NICU, but there is little evidence that it has a positive effect on later development. On the other hand, the study group that reported the SR, this systematic review, earlier also reported the result of this randomized control trial. This study examined the effect of providing a structured neonatal physiotherapy program for low birth weight infants. The program included interventions, positioning, active intervention components such as joint movement or visual stimulation, tactile stimulation, vestibular stimulation, and auditory stimulation, and parent education. This is a treatment strategy and rationale, and this is dosage. The result of intervention showed that the infant's motor activity and motor quality had improved. In addition, this case study examines the effect of early intervention in 4 cases of IVH, intraventricular hemorrhage. All 4 cases, IVH grade 3 to 4, that is severe cases. The intervention method used in this case study is very unique. They call it movement imitation therapy for preterm babies, MITPB. What is done in MITPB is that the doctor or therapist holds the infant, and when the infant makes GMS on its own, the therapist handling the movement naturally to allow the infant to experience appropriate movement. By carefully repeating these interventions, the authors report that all four cases in which later cerebral palsy was strongly suspected were later developed normally. That is amazing. Okay, here is a summary of today. First, medical advances have improved newborn mortality. However, the proportion of infants born with low birth weight has not decreased. And second, low birth weight infants risk of later developmental delay, most particularly cerebral palsy. they need interventions and cares to support their development, and early physiotherapy intervention is practiced. Third, the observation of general movements is recommended as a method of early diagnosis of cerebral palsy and early detection of later developmental disorder. Especially important to evaluate the qualitative characteristics of fidgety movements. Finally, this is the most important point of today's my talk. In order to provide effective physiotherapy based on evidence for low birth weight infant with risk of cerebral palsy, combination of early diagnosis using reliable assessment methods and effective early intervention is essential. As for the specific method of early intervention, I look forward to the next lecture by Dr. No Hansen. Okay, thank you for listening. And I'm not very good at English, so I don't think I'll be able to have a satisfying discussion. But please feel free to ask me any question. Questions are easier for me to answer to if you can text them into the chat box. Okay, thank you very much.
Thank you, Sensei, for the interesting and insightful presentation about relationship between characteristics of spontaneous movement in early infancy and later development of cerebral palsy and neurodevelopmental disorder has given us valuable knowledge. We appreciate your detailed analysis, especially the importance of early diagnosis through general movements, observation, and how these methods can greatly improve the lives of high-risk infants. Thank you once again for sharing your expertise with us today. Now it is the Q&A session. We will have 15 minutes Q&A sessions until 12:15. If anyone has any questions, please type them in the chat box. You can type your question in the chat box so Sensei can read your questions. Okay. If there anyone want to ask. Okay, while we waiting for the questions, I will ask one questions. So, Sensei, what the challenge exists in implementing general movements assessment in low resource settings or rural areas where technology is limited? Like how we can apply the general movement assessment in the area where technology is limited? Thank you, Sensei.
Thank you for question. You mean the how measure the general movement in technology in recent years?
Yes, yes, like the area where the technology is limited. Like maybe there are some areas or country that the technology is not developed in the area. So how can we do the assessment of general movements in that area?
Thank you. In basically, general movements assessment by visual observation, but in recent years, many some papers reported to AI analysis. Please wait. The papers on GM analysis using AI, artificial intelligence, have also increasing recent years. So, えっと、GM assessment is needed to many trainings, but I believe that as AI becomes more wider, stable and reliability and GM evaluation will become possible around the world. That is a very good thing.
Okay, thank you, Sensei, for your answer. So
Oh.
there will questions
Mm.
in the chat box. So
Yeah.
the question is, how can environmental factors such as nutrition, maternal health, and prenatal care during pregnancy influence the development of neurodevelopment in infants? And what preventive measures could reduce this risk? This is the question, Sensei.
Thank you for your question. Please wait. That is also my interest. So I work and okay, I'm working doing research on fetus movement. It is known that low fetus movements affect later development. So it is important for development to move spontaneous movement from the fetal period. So, since the health of pregnant woman is strongly related to the health of her fetus. So I believe that the effect of fetal movement on the development of the infant is also significant. Okay.
Thank you, Sensei. And the next questions from Alwa Abida Muzakira. I would like to understand how to perform a general movement assessment. Is special training needed?
Yes. Yeah. We need the training. In this December, the health in Japan, the GMS training course, and maybe there are Austria and Italy and Indo or China, かな. And, one or two trainings per year, maybe. Please check the homepage of General Movement Trust. There are training information. Please check.
Okay, thank you for the answer, Sensei. Maybe is there anyone want to ask question? You can type them in the chat box.
Thank you.
About the question, how about the questioner? Do you understand the answer from Sensei?
Yes. Are there questions?
No. No. Okay. 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 There may be. Is there any questions again? Maybe one or two questions. As questions from high letter higher, I'd like to ask what are the potential long-term developmental outcomes for infants who display abnormal general movements but do not develop cerebral palsy?
Thank you for your good question. I think ちょっと待ってくださいね。Even in children without cerebral palsy, qualitative abnormalities of GMS can cause motor developmental delay. I'm now conducting research to see if this may be related to DCD, developmental, なんだっけ、developmental coordination disorder, DCD. So, I have interest now.
Thank you for the answer. Now we would like to present a certificate to Associate Professor Hirota Kajima. Okay. One more questions again before we present the certificate. I would like to ask a question. How is physiotherapists in Japan provide good understanding between health professional workers, especially in so that they have assessment?
Thank you. Thank you for your question. We try to exchange information or discussion closely with members of other professionals, such as doctor or nurse and OT, ST. Recently, the number of physiotherapists who exclusively work in the NICU has been increasing in Japan.
Okay, thank you for the answer, Sensei. Sensei, is there anyone wanna ask questions for raising the certificate?
Mm.
Okay, because the time is up, so we will. Okay, there are one questions again. Thank you for the lecture, Professor. Do you have any suggestions for us on how to study about GMS before we take the official training? And is possible for us to stimulate fit getting movement? It is from Miss Koirina Fachani.
Thank you for the question. There are a few opportunities that GMS training. So, this is the text of GMS, and that paper attached the DVD and many cases of normal GMS and abnormal GMS. So we show their videos and training yourself or myself. I don't know and I want to know the possible for stimulus and enhance their fidgety movement if can possible. That is maybe become the very good intervention for low birth weight or high risk infants.
Okay, thank you, Sensei, for the recommendation of the book. And still one more question. It is from Anggun Indah Lestari. I think it's still being struggle for PT in Indonesia to provide assessment in intensive care unit in Indonesia, especially in Makassar City. Interprofessional collaboration is still have many way to go. Okay.
Thank you for your comments.
Okay, thank you for the answer. Okay.
Mm.
Is there anyone want to ask again? Okay, maybe it's enough for the Q&A session. Thank you for all the questions. It's so very interesting questions for us. Now we will like to present this certificate to Associate Professor Hirata Kagima. The Associate Professor Hirata Kagima certificate will be presented by Verly Christian Puahadi, President of the Student Consultative Council of Hemophysiology, Faculty of Nursing, Hasanuddin University. Okay, please for Verly Christian Puahadi.
Okay, thanks to moderator. Thank you to Associate Professor Hirota Kagima for the great knowledge and insight he has given us. As appreciation, the Pediatric Physiotherapy Winner 2024 committee is proud to present the certificate and appreciation for his for you participant and contribution to this webinar. Thank you, Sensei.
ありがとうございました。
Okay. Thank you for presenting the certificate to Jima Sensei. And thank you so much, Sensei, for your great presentation today. Okay. And also thank you for all the participants in the morning sessions. And I kindly ask for all participants to mute their microphones during the presentations. Thank you for your cooperation. Now I will return the session back to the Master of Ceremony to inform about the break time. Thank you.
Okay, thank you. Thank you so much for moderator. So we would like to appeal to all participants to rejoin Zoom at 1 p.m. as we would like to start the next topic. So now we going to break to so everyone. So we would like to appeal to all participants to rejoin Zoom at 1 p.m. as we would like to start the next topic. Have
Recording stopped.